So people often come to see me for an assessment of whether they're right for a face or neck lift, often when they're feeling a little bit like their outside appearance is not sort of keeping in track with how they feel otherwise. One of the things there's a lot of, not misinformation, but confusion about what a neck or facelift might be. A facelift actually really affects the jawline and the neck itself. So a lot of people think of the face being from here up, obviously, but around the eyes and forehead, but that's not actually what a facelift looks to address. A facelift itself really addresses a band through your jawline to get good definition of the jaw and also into the neck. So once that's sort of clarified, then we talk about what aspects is of concern to that patient. And as people age, they age in different ways and at different speeds. A lot of it's to do with congenital factors, which you can't do too much about, what your underlying bone structure's like, what the shape of your face is, how much support you've got on your chin. All these things affect how you age. There's some things that can accelerate aging, like smoking and sun exposure, but that all culminates in what happens to that person that's sitting there having the consultation. So a facelift is particularly good at redefining jawline, so often people lose support through that jawline, or they get the jowly sort of look, and that's quite a very good thing that a facelift can look at addressing. And the other thing is looseness, or either loose skin and or lack of support and fullness with excess fatty tissue in the neck. And a facelift, as part of as what I would call a normal facelift, also addresses the neck. So often people will come in and say, I want to do this or this, and that's actually a good indication that a facelift will look at addressing those concerns. The other areas generally looking at eyelid surgery, so upper or lower eyelid or blepharoplasty. Occasionally you might look at something to do with the cheek or the malar prominence, and the term for that would be involving a mid-facelift, which is just in this section, but that's quite an uncommon thing to have to do. For most people, what their concerns are really about the heaviness in the jaw and the neck.